All right. Hello and welcome everyone. And we are going to formally start our session now. Okay, brilliant, Anna. That's very good. That's very good. Okay, that's very good. So we are going to start our session, and before we go on, I would like to welcome all of you on the platform of Pedicurix. And as you all know, that I am Dr.Zaib Qureshi. So I'll be taking this session today, and of course the course as well. I welcome you all wholeheartedly. So today we are going to talk about that what exactly the MRCOG Part 2 is. How are we going to crack it? All right, because this exam is what, you know, everybody says that MRCOG part 2, MRCOG part 2, or say, the MRCOG. Okay. So MRCOG, I'm sure you all know that it has got three parts, right? MRCOG 1, 2, and 3. All right. So before we go on and talk about this is me, I'm sure everybody knows, and I have finished my almost all degrees years ago. So while I entered into this MRCOG program, I was already FCPS from Pakistan. Then I did MRCPI, then I did European board, then a couple of other diplomas and certifications as well, which I don't mention around. So, but this is me. All right. You guys would be seeing me quite oftenly here and there, okay? And because I do teach, I do, they conduct other sessions as well. So yes. So this is RCOG building, okay, on the Union Street, which every candidate would love to go and do the photo shoot. Okay, so this is a very beautiful building and it's in London, it's on Union Street, and this should be your dream, okay? That one day you will go there, you will attend your convocation and you would be standing there. And perhaps, if you are part of me or, having this journey with me, so I'll be so happy to be with you, okay? So yes, as I was talking about that MRCOG, it has got part 1, part 2, which is a bridge. Okay, and then part 3. Part 1 gives you your basics. Okay, part 2 is going to be more towards your clinical knowledge. You are just going to brush up your clinical knowledge, and part 3 is going to be the integration of your basic and the clinical knowledge, because in here you are going to be talking to the patients, of course the simulated patients, but yes, patients. Okay, so bridge. When we say it's a bridge, so bridge is going to be like this. The long one, the hard one, and difficult to, the cross, right? Sometimes there can be hurdles, sometimes there can be obstacles, sometimes there can be so many things. Okay, sometimes the speed can be slow, sometimes you can be tired, but you should not be doing or quitting the path. What we do, okay, we start from one end and we do try to, cross the bridge, and then we do try to reach by the end of that bridge, isn't it? So when we say that, MRCOG part 2 is bridge, yes, it is going to be lengthy. It is going to be a bit, the technical, or you can say difficult, but not impossible. Okay. So when I say it's not impossible, because it's not impossible, when I can do it as a student, so yes, you can also do it. All right. So never say that, and don't, listen to anyone who says that, MRCUG is difficult, nobody can do it. Yes, it is difficult, but it is not impossible, right? So this is only you who is going to make this journey, the easy. Okay, by what? By your daily consistent study, by being focused in your journey, by just following the schedule, a dedicated schedule. All right, and then yes, you are going to be good. If you are just going to, the stop here, stop here, stop here, so this is just going to slow down your speed and you won't be able to cross your bridge in the given time, right? So always think about that. Why are you in this MRCOG journey? What is your goal? What is your aim? Why would you want to become MRCOG? So if I ask any one of you that why would you like to become MRCOG, what would your answer be? Then I will tell you that why I wanted to become MRCOG. So anyone, if you guys can open your mic and just tell me that why would you like to do this MRCOG? Why are you in this MRCOG business? Hmm? Anyone? Anyone? Anyone is open to talk, so you guys can open your mic and just, talk to me. Why do you want to become a MRCOG?
To become a good gynecologist.
Very good, very good. So, do you think that MRCOG is going to enhance your skills?
Ma'am, to improve my knowledge.
Mm-hmm.
Yes,
Mm-hmm.
ma'am. To become again more knowledge.
Ma'am, to improve my knowledge.
To improve your knowledge. And in turn, what will happen? That knowledge will be beneficial for your patients, isn't it? Everybody, because we all are doctors, right? We all are chosen one. So, why do we work? And what do we work? Because we all are obstetrics, we are all practicing obstetrics and gynecology. So ultimately, what we want to become, for me, because I have just told you that when I entered into this MRCOG, I already was FCPS. Okay, I was working as a full-time registrar and everything. Okay, I almost have achieved, the one of the prestigious qualification, but yet I wanted to become this MRCOG. The ultimate goal was that to improve on my, the clinical skills in the lines of evidence-based guidelines. All right. So in turn, what happened? That after becoming a MRCOG, I, noticed the vast improvement in myself. While I was talking to patients, I was giving more time, I was being empathetic, I was being sympathetic to them. My, the clinical skills were like, what you can say, that much more improved than before becoming the MRCOG. Although I was like, okay, but yes, now I was talking and walking, in the lines of evidence-based management. Now I knew that, how am I going to manage a certain disease in the lines of guidelines. All right. So what happens now is that, when I talk to my patients, they give them time. Okay. In the end of consultation, I do try to ask them that, do you have any question? Do you want me to repeat anything? Which the sadly was lacking, in our training. All right. So yes, MRCOG gives you, you can say the wings, okay, to fly high, to improve on your clinical skills and to improve on your theoretical knowledge as well. Okay, because ultimately, many students say that, okay, yes, we want to relocate. Okay, yes, we want to go to, or we want to go to the UK or Ireland. Yes, anyone can go anywhere with this qualification, isn't it? But ultimately, what exactly do we want to become? We want to become good clinician. All right. So yes, MRCOG 2 is going to be you can say the longest, the hardest, and the kind of difficult bridge to cross to become your MRCOG. Okay, because MRCOG is going to be your ultimate goal. All right, so you will start your journey, then you will, the travel around, and then you will become MRCOG. All right, all this is going to be possible once you are just going to look at this, the corner of the bridge, not this. Once you are going to be focused on the obstacles, once you are going to be focused on your hurdles, then yes, you are going to be slow. You are going to be, the swaying here and there, which is not a good idea. Okay. So what exactly we are going to be doing is I'll be talking about all these tips and tricks. So first I would be talking about the curriculum. Many of you guys already know what curriculum is, but we are going to be talking in depth about it. Then I'll be telling you with the help of my, the vast knowledge of being student first and then being a teacher, that how to prepare for MRCOG, then effective and general strategies to prepare. And in the end, I would be talking a bit about my, the course as well. So I'm sure you all know that MRCOG has got curriculum. Okay, like I've been telling you that part one is your basics. Okay, many students are here from the part one directly, and maybe they don't know about the curriculum. So when we say it is basics, so basics means that you have done anatomy, physiology, pathology, and biochemistry, pharmacology, and all. Okay, and now you are going to be bringing that basic knowledge into the clinical knowledge because now your concepts are clear, and now you are going to be talking in terms of your clinical grounds. Whatever you have studied in part one, now you are going to be applying that in the lines of, the guidelines. So yes, and then when you are going to be incorporating both, then you are going to be talking for part three. All right. So in part one, you have had subjects, right? You have had, say, 9 subjects or 10 subjects. But in part two, you are going to be dividing all these into modules. So we call them as modules. All right. So we have got almost 18 modules, and 18 modules will be, collapsing with each other, and they are going to be either 13, 12, or 14. Like clinical skills, teaching, appraisal, and assessment. Clinical skills, yes. When we are going to be talking about the MRCOG curriculum in the lines of, their training, then teaching, appraisal, and assessment. Because MRCOG is what? It's for us, maybe it's an additional, the qualification as an overseas candidate, but for NHS and the UK local trainees, it's the mandatory exam to go for. All right, because if they are in their OBG training, so they have to do this MRCOG to, the enter into subspecialty or to enter into any higher specialty. All right. So yes, we will be talking about appraisals, how it is done, what is the assessment, how NHS system works, and then IT. Sometimes they are going to be together. Clinical governance and research. When we say clinical governance, we are going to be talking about how a system or the framework in NHS is. Okay, the working framework of the hospital. Then our, the modules comes, which we have to study. We all have to study core surgical skills. Okay, when we say it is surgical, then yes, surgical. We will be talking about cesarean section, we will be talking about laparotomies, we will be talking about myomectomy, hysterectomy. Then when we say hysterectomy, then yes, abdominal, laparoscopic, and then robotic, and then vaginal hysterectomy as well. Then if we have done any surgery, we will be talking about postoperative cares. Core surgical skills, because we will be talking about sutures, we will be talking about the needles, we will be talking about the wounds, different type of wounds, different type of scars. Okay, all these things. So when we will be talking, when we will be studying about all this, we will be the covering these two modules. Sometimes they the overlap. Surgical procedures, yes. Then this is the core of this, the lengthy MRCOG part 2, antenatal care and maternal medicine. When we say it is maternal medicine, it's going to be, of course, medicine, all right? Because, it's very vast, we all know, right? So we will be dealing with so many diseases, but certainly we cannot cover all medical disorders. So we will be, technically you can say that we will be limiting ourselves to the most common disorders which complicate a woman in pregnancy. All right. So what are those? Diabetes, hypertension, all right, renal disorders, thyroid disorders, okay, liver disorders, then asthma, all right. So all these important topics. So from where to cover them? Yes, that is going to be your syllabus. So all these modules would be covered from the recommended curriculum, recommended sources. We will be talking in the upcoming slides. Then management of labor and delivery, postpartum problem, which is purpurum. Then we have got gynecological problems. Gynecological problems mean the benign gynecology, all right? We will be talking about a couple of diseases like, the polycystic ovarian syndrome, like premenstrual syndrome, like chronic pelvic pain, all right? Then dysmenorrhea, amenorrhea, secondary amenorrhea and all right? Subfertility in itself is a subspecialty, but yes, as a OBG candidate, we have to cover a couple of, the important stuff. Sexual and reproductive health, we will be talking about, the different type of infections, sexually health related problems, and then yes, which is going to in turn influence the reproductive health of a woman or a couple. Early pregnancy care, general oncology, gynecological oncology, and urogynecology. Okay, stop. Here I want to address a very important thing. Like I said earlier, that this may be an additional qualification for overseas candidate, but for NHS candidate, but for UK candidates, it's a mandatory exam. All right, doesn't matter if you are working as an independent, the specialist or consultant in your country or in any of your hospital. But for, the UK exam, you are still a student. So when we say that subfertility, when we say sexual and reproductive health, when we say this gynecological oncology, urogynecology, I'm sure you all know that these are, the subspecialties for gynecology, isn't it? This is a subspecialty in itself. This is a subspecialty in itself, isn't it? So, don't try to become a subspecialist. Okay, don't try to think that, I have to know each tit and bit of this module. Okay, no, you just have to have a basic concept that what are the important problems in the urogynecology, what are the important the topics to cover from urogynecology, or say subfertility. So fertility looks like for MRCOG curriculum, it's not that big. But yes, as a whole subspecialty, when we talk about, it's a different, the kind of subspecialty, isn't it? So for MRCOG curriculum, you have to have at least basic knowledge of almost all these modules. All right. So by the end of this MRCOG, nobody is expecting you to behave like a consultant. Nobody is, expecting you to behave like a specialist. All right. Clear so far? Any question? Clear, everyone? All right. Great. Good. Okay. So almost all these are going to be the important modules. Okay. So if we say that, all these modules, they're not going to be 18, but yes, they are going to be, say, the 12 or 13 or say 14, because from here, your part 3 will be there. Okay. Part 3 will be based on all these modules. All right. There is going to be one station on, the core surgical skills, or maybe, the post-operative care, surgical procedure, antenatal care, maternal medicine, then labor and delivery, postpartum, gynecological, subfertility, sexual and reproductive. So almost 14 stations are going to be in your part 3 based on these modules. So now what your ultimate goal should be, aside, being a good clinician for this exam, your goal should be that you have to have your concepts clear. All right, because these concepts are going to take you long way towards your MRCOG dream. All right, because the same concepts are going to work for your MRCOG part 3. All right, so always remember, please write it down and revise it on daily basis that keep your concepts clear. Because if your concepts are not clear, and if you think that you are just going to go for this exam like this, trust me, that's not going to work for you at all. Because part 2 needs a lot of, the concept. All right, because this is not the era when, the maybe like 4 to 5 years ago, there were, the questions which are going to be repeated from, the past exam or recalls, but this is not the case now. All right, keeping in view that they are bringing, the more tough exam. So doesn't matter, the which question is coming from which module. If you are thorough with your curriculum, if you are thorough with your all modules, trust me, nobody can beat you. But if you will be looking at all these past papers, questions here and there, and listening to everyone that no, questions are very easy. This exam was from past papers or the recalls questions. Trust me, you are going to be in a big trouble. Okay, so don't keep your mind in a fix of this thing that you just have to cover your recalls. No, you have to cover all these modules. You have to keep your concepts clear. Doesn't matter, the question is coming from this corner, or this corner. If you are very well in your studies, you are very thorough in your concepts, you can solve every question there is. All right. So we are done with the curriculum, and then we are going to be talking about how exam is there. All right. So almost, the out of 100%, 40%, you can say that weightage is for single best answers, and 60% is for extended match questions. These extended match questions are the hardest part of, the exam. So exam has always been difficult. I still remember back in 2017-18 when I was preparing for my exam. The exam was like this, okay? I flunked this exam only with 2% in 2017. Then I passed in 2018, okay, January. So it happens. And I flunked in at that time, they used to give, the marks of, the gynecology and ops, and I flunked in ops. But now they are giving you, if God forbid anybody fails, so they give you marks on the basis of almost every module. That which module did you cover, which module did you pass, and what were the ratio of your preparation. But make sure that each and every question counts in exam. because you can fail with 1% and you can pass with 1% as well. So fight for every single, the percentage. All right. So it means that you have to, the score good to pass this exam. For the last, the couple of years, the percentage is somewhere between, the 60 to 65. It's not that much. So all you have to do is that you just have to prepare well. So at least you can score this much. All right. So generally, there are going to be, the two papers. Exam is all about multiple choice answers termed as single best answers and EMQs. Each exam is of 3 hours, okay? And you will have single best answers and EMQs in both, okay? 100 questions in both. So almost you can simply say that paper one, 50 questions are going to be single best answers, 50 questions, the EMQs, and the total 3 hours. Roughly, the how we teachers say that, how you can do, at least you can give, the 1 minute to each question, or say roughly 70, and 110 to 120 minutes to EMQs. So this is how you can cover your 180 minutes. All right. Then there is going to be hardly, the 1 hour break. Okay. And then you are going to be giving the second paper similar to paper one. So now we will talk about the bulk preparation. Okay. Now we will talk about the sources and resources, from where you have to study, how you have to study. All right. So the major bulk of this exam, because we are talking about RCOG exam. All right. So your major bulk is RCOG. Okay. RCOG, Green Top Guidelines. And then you have got the second main source, which is NICE guidelines. All right. So the topics which are not covered in almost these two, you have to cover from rest of the, the recommended sources. All right. Then you have, the TOG articles. All right. So at least 3 to 5 years TOG articles are mandatory to cover, and topics which are not covered in, these 3 to 5 years. I will be telling you in upcoming slides. Then BASH guidelines, only important infections. What is BASH? British Association of Sexual Health and HIV. All right. Then you have got another important guideline, which is NHS cervical screening program, colposcopy guideline. Then you have got Faculty of Sexual and Reproductive Health guidelines. Means you will be talking about contraception, you will be talking about, the all methods, okay? Oral, implants, injectables, the intrauterine contraception in elderly, contraception in youngs, contraception in cardiac diseases. There are almost 50 or 50 plus guidelines. But for you just have to cover the important topics. For any MRCOG or for any OBG candidate who do not have any basic idea of, the OCP, not basic idea about POP, then, the emergency contraception, then missed pills, then, sorry to say, he or she does not deserve to be an OBG, because, the basic concept should be there. You should be knowing that what are the important, the aspects of all these, the pills. Okay, estrogen, how does estrogen works? How does progesterone works? How does emergency contraception works? So at least important ones should be on your tips. Then there are a couple of consent advices, because we have just spoken about the surgical skills. When we say surgical skills, then yes, before by rule, I think by default, we all know that before taking the patient to theater, we have to take the consent. And luckily, RCOG curriculum is very clear that they give us idea about almost all consent about important, the procedures. So yes, you have to cover consent advices, some good practice papers you have to do, and then you have to do the mother and baby, the child report. Okay, mortality and morbidity and all. For the at least last two reports, you should cover. All right. Like, for example, what were the direct causes of maternal death? What were the indirect causes amongst, the direct one? Which was the most important, the system which was affected, blah, blah, blah. Okay, something like that. So this is your major, the, what you can say, the guideline for your preparation. So what you have to focus on first, this, because when you will be talking about, in terms of references, so your first reference should be Green Top guideline or RCOG guideline, and then you have to be talking about NICE guidelines. Okay, so at least 60 to 70% curriculum is this, and rest, 30 to 40%, or say 25 to 30% is this. So what is important? Important is this. So these guidelines should be on your tips. All right. Tips means that you should be knowing that which line, which part, which percentage is given in which guideline, and how are you going to manage. Okay. So I'm sure all of you guys have seen what are the green top guidelines, what are the nice guidelines, right? So if not, then you can go to www dot the rcog.org.uk, and similarly nice.org.uk. Okay, or another quick way to find out any guideline is that you just write, for example, PPH, GTG, nausea, vomiting in pregnancy, GTG. So this way a window will open. For this exam, you have to have your, the what you can say, a basic knowledge of social media as well. All right. Having said that, social media does not mean that you will be part of thousands and thousands of groups around, and you will be just scrolling the messages here and there, and you will be listening to everybody there is. All right. Social media means that how are you going to scroll, how are you going to search, how are you going to bring the basic, or the best evidence possible answer for your, the question. All right. So almost 60 plus guidelines are on website starting from 2010 to 2025. All right. So once you will go to your www.rcog guidelines, this window will open. You will go to the guidance. Okay. You will go to the guidance, and once you will click to the guidance, this window will open. Now they have done a very beautiful thing. Earlier it was not like this, that they have separately mentioned obstetrics and then the basic parts. If you want to scroll through antepartum hemorrhage, then birth after previous cesarean section, blood transfusion, care of late IUFT and stillbirth, so this window will open. All right. So like this, all these guidelines are there. So you can see that in antenatal care, there are how many guidelines? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Okay. For example, if you want to open this guideline, so you will click to this, the window. All right. So you will click to this and a window will open. Okay. Let me show you that. I think I have, opened it. Okay, yeah. For example, this is how you are going to open, all right? So once you will go to the Green Top Guideline page, you will click at the guidance and then Green Top Guidelines. Okay, this window will open. So if you want to open epilepsy in pregnancy, then another window will open. Then there is going to be access to the PDF version. Okay, this PDF version will come. If you want to download, you can download. If you want to print, you can print. So it all depends on you that how do you want to study. All right. Like for me, I'm a hard copy person. So yes, I bought a printer myself. Okay. And that printer is still with me. And it's been like 9 years now. Okay. While I was preparing for my part one, so I had that printer, and till date, that printer is with me. Anything, if I want to print, I will just click on this and, that print copy is with me. So you can also do that, okay? Buy a reasonable printer, okay? Get it attached with your laptop or desktop or anything, okay? So you will have a hard copy as well. The beauty of hard copy is that you will get, the few pages by the end of, this. You can add your own important points. So what I used to do was that I used to write my own points as well, okay? I used to, take all these, you can say, the charts, for example, for epilepsy, obesity, PPROM, antepartum hemorrhage, postpartum hemorrhage, placenta previa, yeah. Okay, let me open this guideline. I will show you that almost, the many guidelines have some flow charts or some treatment charts in the end. Okay, for example, like this. All right, like this. What you need to do is that you can print this chart. All right, you can print this chart. Okay, you can print this chart and you can keep a folder of it. And you can even add your important points in here. So a one paper summary will be ready for you by the end of your preparation. Can you see the window? Right? Can you see it now? Hmm? Okay. So every flow chart you can print. Okay, if you have printer with you, so you can print this flow chart with you, and then you can easily go through it. All right. So I was just showing you this screen. So let me go through again. You will type the rcog.uk. All right. So this window will open guidance. You will go to green top guideline. So this window will open, and then you can open any guideline there is. For example, I have opened this one. Okay. So for example, these are the archived guideline. For example, this guideline is there, small for guide. So you can have two versions, PDF version if you want to open it. All right. So like this. So you can open, all right. You want to download, you can download. Okay. If you want to, if you are a soft copy person, if you are a hard copy person, it's all up to you. If you want to download, you can download from here. All right. So I was telling you about, the flow charts and all. So almost important guidelines have, the flow charts in the end. All right. So what you can do is you can get them printed, okay, for your rapid revision, because few things like this flow chart. This flow chart is important, not for your part 2, for your part 3 as well, because all these risk factors, they have to be on your tips, number 1. All right. So this should be on your tips. So for me, like when I was a student, okay, in all my exams. So what I used to do was I used to get all these charts printed and they were pasted in my room, okay, on window, on walls, on doors, on my room fridge, everywhere. So whenever I will, the go, I will have a look. So at least I can, the stand in front of this for 1 minute and I can quickly revise it. Similarly, you have got, the deep venous thrombosis charts, okay? Those charts are very lengthy as well. You have to revise them again and again, okay? Like for example, this, the anti-D chart, okay? These have been archived. So we will have new thrombosis and, the green top guideline thrombosis, okay? This guideline, PDF version. This also has, the charts in the end. So get them printed. Okay, showing you everything in depth is that the students who are, the new to Mrcog, so at least they will have idea that how these guidelines work. And then another question comes that how to read the guideline. Okay, so if you will go to this guideline, for example, so in the first few pages, there is going to be executive summary. You can get this executive summary printed as well. Okay, so at least you will have a quick idea and then you can add your rest of the point by reading the complete guideline. But it's mandatory that green top guideline should be read end to end. All right. For example, this is timing of the initiation of thromboprophylaxis. So almost all these bold lines which are there, these are mandatory to memorize. Okay. Then comes few studies. Okay. Then comes like, for example, this is introduction and background. You're not going to look at this. Okay, you are just going to see that pulmonary embolism remains a leading direct cause of the maternal death in UK. Okay, this is important. Then, another thing, then you are going to say that identification and assessment, there is nothing to remember. Then pregnancy and risk assessment, then these bold, the letters, these should be on your tips. All right. Then there is study. Okay. It is written that the risk factors are listed in table 1. You will quickly go to the table 1. You will look at this. You will look at the appendix 2. All right. And appendix 2 and list 1 is that. Then they have elaborated almost all risk factors. So you have to study. And if you find any important thing which is important for you, because everybody has a different, the perspective to look at, the anything. Sometimes that thing might be important for you, that might not be important for me because I already have a concept about it. So never compare your journeys with anyone. Okay, never compare your, the mental level to understand things with anyone. all right? And never be discouraged, never be disheartened as well, because everybody has a different wavelength and everybody has a different, the kind of, the way to look at the certain things, all right? So yes, this is important that you should have a clear idea, all right? Then again, this is how you have to study a guideline. Similarly, for every guideline there is, you have to study importantly, okay? Like these charts should be on your tips, okay? These are the references. So yes, you don't have to study the references, but yes, you have to study, the rest of the guidelines, important ones. These, the charts, okay? These important things. Don't go into the depth, but yes, important crux should be on your, the tips. For example, this is importantly written that antenatal steroids should be the offer to women between 24 to 34 plus 6 weeks, ideally 48 hours before an anticipated birth. This is for antenatal corticosteroids for IUGR baby. Okay, so this is important. What I used to do was that I used to write all these points in my notebook. So by the end of preparation, I had my own, the summary ready for me to revise from. Okay, so everybody has a different, if you think that you can print and you can keep everything with you, so it's all up to you. If you think that you can study on the laptop, desktop or iPad or anything, so it's all up to you. If you think that you have to write and then you have to revise it from your own notes, it's all up to you as well. So it's not a hard and fast rule, everyone. Okay, so like I said, that everybody has a different wavelength and different, the strategy to study. So don't think that, if somebody is studying this way, that you have to study this way as well. Okay. So just remember, the only thing which is going to keep you going is your consistency, your resilience, your perseverance. Okay. And if you are going to be, that good and that focused, only that is going to help you all along. All right. Otherwise, no amount of, the courses, no amount of ready-made, the material, no amount of content which has been collected from here and there is going to help you at all. Okay. So remember that what you have to do is that you have to study on daily basis. This is July and you still have got almost 6 months. Okay, because exam is going to be by the end of January, so you will have almost the whole January month as well, and then yes, this the 5 months as well. So this is more than enough for anyone to start study from. Okay, and if you think that any miracle will happen and then you are going to pass this exam, then I'm sorry, you are wrong. Okay, this, like I said, that this journey might be overwhelming, this might be the difficult, tough, or sometimes the exhausting, sometimes the depressing, but yes, it is going to be, there. All right, so don't be afraid, don't be disheartened, don't be upset. Okay, don't be demotivated, and don't be distracted. Another important thing, if you are part of the thousands and thousands groups here and there, WhatsApp, Telegram, Facebook, and if you think that you can study from all those groups, and if you think that yes, all those groups are helpful for you, then good enough. If not, then choose one, two, three, or you think the four groups which are helpful for you, not for anyone. All right, if you think that you can be benefited from all those discussion, then yes, it's a good idea. Otherwise you will be the ending your day by just reading all those thousands and thousands of messages, because for me it was a kind of the bit cumbersome. It was putting a toll on my the eyesight, my the mental well-being, my the physical well-being as well, because as long as you are going to be focused on your the screen, it is going to hamper your vision, it is going to hamper your the capability to understand things. Okay, so limit your limit your energies mentally, psychologically, as well as physically. Okay, so do try to understand that this exam is important for you and only you. That's it. Khalas, nothing more, nothing less. All right. So these are the, the Green Top guideline, all these guidelines. If you can see that, they have divided it into, the modules kind of thing. Okay, which is good, I think. Okay, so you can, the go to any guideline if you wish to, if you want to study any guideline. For example, this is ectopic pregnancy guideline. So, this guideline will open. You will open like this if you want to study from PDF version. So it's all up to you. All right. So it all depends on that. How do you want to study? Okay. So, and always remember when you look at the edition, look at this part as well. Okay. That when it was updated, always remember your knowledge should be very up to date. Okay. You should be studying, the nicely. All right. I hope everything is clear so far. Hmm? Any question and ambiguity? No? Okay, brilliant. All right. So how to read a guideline? We have just, discussed. Read thoroughly, note down recommendations if you wish to. All right, like incidences, prevalences, recurrence, and charts, flow charts. Flow charts are very important. Okay. If you open the HMB guideline, heavy menstrual bleeding guideline, you would be amazed that almost, the all types of HMB, hyperplasia, especially hyperplasia is mentioned over there very nicely in the charts. And your exam would be based on that chart only. All right. So make sure, you have a strong grip on all those charts because many EMQs would be on the based on flow charts. All right. So how are you going to, write down, if you want to write down the notes, you are going to, make your notes folder by folder, and this is how you can study. All right. So it all up to you. Like for me, I had my notebook and I had made sections, for example, the antenatal care section, maternal medicine section, fertility section. All right. One folder was for obstetrics and the other folder was gynecology. So I had my own notes ready, and till date, I am using those notes, and those notes travel with me all around the globe. Okay. Then comes nice guidelines. National Institute of Health and Care Excellence. Almost 15 to 20 guidelines to be covered from the NICE website. For example, diabetes mellitus, hypertension, fertility, incontinence, or urogynecology, mental health, cesarean section, intrapartum care, menopause, postnatal care, surgical site infection, induction, preterm labor. Okay, so you can see that important, the medical disorders are in NICE guideline. Important, that this module is in the NICE guideline. Fertility is in the NICE guideline, right? And then comes, the labor, preterm labor, induction of labor, intrapartum care, antenatal care, right? Postnatal care, labor, delivery, and postpartum, the guideline is there. So NICE guideline, very important. All right. So all these guidelines needs to be covered from NICE guideline. And remember, NICE is not that nice. Okay. So NICE is not that nice. Having said that, it means that, NICE guideline is not clear because if we talk about the green top guideline and compare it with the NICE guideline, we would see a gross difference. Green top guideline is very clear. Okay, they would clearly say that this is the recommendations, but NICE guideline would be talking about offer, consider, and discuss. So these words are going to be there. So it means you have to read each line very carefully. And then you have to focus on these words. Offer. Offer mean that you have to give this thing by hook or crook. Okay. Then there is consider. Consider mean plus minus, that you have to give or not to give. That would be a mutual discussion. And then there is going to be discuss. Discuss would be because the many important guidelines are labor and delivery, infertility, urinary incontinence, and the hypertension, diabetes. So discuss means perhaps the if we talk about that preterm labor, then there is going to be extreme prematurity, like 22 to 24 weeks of gestation. So this is a very critical, the gestational age in which we are not sure about the survival of the fetus, right? Then we are going to be talking about discussing about the options available at this. So this is going to be the discuss, and then there is going to be a final conclusion. So you can see that nice is not that nice that you just have to focus on one thing, one recommendation, which is offer. you have to be thinking about the word consider, you have to be thinking about the word discuss as well. All right. So NICE guideline needs to be read thoroughly, carefully, and then you have to memorize it well as well. Okay. Then comes TOG articles. So TOG is what? TOG is the obstetrician and gynecologist. Wherever you would see this green color, so just think about that this reference is from TOG article. Okay, so TOG article is the opinion. For example, anything which is opinionated by you, by me, by any candidate. Okay, and because this is a journal of Royal College of Obstetrics and Gynecologist, and it has got 4 volumes. It comes every year, January, April, July, and October. 4 issues. We call them as issues, okay, or volume. So 4 volume, and every volume has at least 5 to 6 articles. Okay, so on average, 20 topics or 20 articles to be read in 1 year. Maybe not all 20 would be important for a Mrcog curriculum, but yes, perhaps the 1 or 2 or 3 would be important. For example, a recent TOG article came in July, okay? The vaginal, for example, vaginal estrogen, the deficiency, that is not a guideline anywhere, okay? Earlier last year, the guideline came thyroid disorders in pregnancy, green top guideline, and now there is another, you can say the study or the article which has been conducted by the couple of, the doctors in the NHS. So now there we have another thing. But when we will be talking about the answers in exam, our first priority would be GTG, okay, for reference, or Green Top Guideline, or RCOG Guideline, the same name. All right. First preference is Green Top Guideline. If the same thing is given in the TOG article, then TOG article would be our, the second preference. But our first preference would be Green Top Guideline. For example, we have got guidelines of epilepsy, and then we have got a TOG article of epilepsy as well. So if in exam anything comes, okay, so our first preference would be Green Top Guideline for that question, particular question. If the answer is not in the Green Top Guideline, then perhaps we will be taking reference from TOG article. All right. So this is how you pick your reference source as well in exam. All right. So always remember, first preference is your Green Top Guideline. And if one topic is given in Green Top Guideline, NICE Guideline, and TOG article as well, again, first preference is Green Top Guideline. All right. Mark my words that if you have, read your Green Top Guideline quite nicely, you have made your concepts clear, everything is okay. So Green Top Guideline, NICE Guideline makes a huge bulk of your curriculum, 60 to 70%. It means then rest 20 to 30% or 40% would be covered from TOG article, HIV guidelines, BASH guidelines, FSRH guidelines, consent advice, or TOG article. All right. So if you have covered your 60 to 70% curriculum, don't you think that you have covered, the bulk of your preparation? Answer is yes, you did. All right. So make sure that you are, the doing, either you start your studies by, if you are part of your course. So many mentors, they make their, the schedule according to the modules. So if we say that modules, so we as a teacher, we do try to have a 360-degree look on all, the given, the syllabus curriculum, and then we pick almost important topics from every, the source, Green Top Guideline, NICE Guideline, TOG article, or anywhere. If if we think that topic is being discussed anywhere in the curriculum. All right. So we will extract and we will summarize and we will teach accordingly. All right. Or if you are studying yourself, then there can be any way to study, to start study. All right. So you can study, okay, like the from Green Top Guideline, finish your Green Top Guideline first, then NICE Guideline. Or if you want to go, I the personally prefer module by module, because Once your one module is covered, okay, you will be satisfied mentally, okay, that you have done this, you have done this. Otherwise, you will just be juggling from one topic to the other topic. All right. So last 3 to 4 years, talk articles to be read, the as a the curriculum. All right. And then you are going to be the covering topics which are not the covered in the last 3 to 4 years. All right. And what are those topics? So they can be cystic fibrosis, headache in pregnancy, enhanced recovery program, nerve injury, spinal cord injury, skin eruptions in pregnancy, hyperprolactinemia, surrogacy, SLE, appendicitis, abdominal incision sutures, abdominal circulage, myocardial infarction. Now there is a talk article in 2023, acute coronary syndrome. And I have a very, I think I have discussed it in, the free session, and it's available on the YouTube channel as well. Okay. So you guys can, go to my YouTube channels. There are multiple topics which are being discussed by me. All right. New guidelines, new talk articles. So you can even listen to them as well. Bariatric surgery, borderline ovarian tumors, polyhydramnios, asthma in pregnancy, liver masses in pregnancy, and ovarian cyst in pregnancy as well. Management of fibroids in pregnancies as well. So these are the old talk article. Having said old talks does not mean that old, but it means, they are not in 3 to 5 years recent. Okay. For example, headache in pregnancy is, I think, 2014. Okay. Polyhydramnios is again 2016 or 17. Asthma is again like this. And hyperprolactinemia, even, the more old. So like this. Okay. So yes, you have to cover all these talk articles as well. Many talk articles are freely available on Google, and many talk articles are, the freely available in your, the study groups as well. If something is not there, you guys can tag us if you are part of our group, and if you are part of our course, then yes, we are going to provide you that. All right, to study from, to cover that important thing. And if not, you guys can always, the approach to me, you guys can ask me or my team member as well. We do try to help every candidate there is. All right. And how to read talk article? Talk article is like a story, because hardly they are going to be of 3 to 4 pages. Okay. So read it like a story, note down important points. For me, I do that. Focus on tables, algorithms, mostly straight questions, single best answers questions. They will come from talk articles. All right. So talk articles basically, and like I said earlier, that anything which has, the flow chart or algorithm in the end of talk article or in the end of any guideline. So many EMQs would be based on that flow chart. Okay, so make it a habit from the start of your, the studies, that you do try to extract, the important pages, important algorithms, and please, buy your own printer, get it printed, and make your own folder. Okay. So SBA and EMQ practice is very important. So from where this question is, why they are asking this, what is the crux of this, when, how, who? I'm sure we all know this, right? From the very beginning when we enter into our studies. So if any student who do not have any, the understanding of asking question or seeking help, or, that from where this question is, what they are asking, what is the the answer, from where it is coming. Okay. So that is not going to be helpful. All right. So make sure that you are doing it. All right. So always think of that, where is the the answer, where is the reference. Don't blindly the what you can say, that accept any key which is given here and there. Okay. Or maybe answer given here and there. So try to find out your own answer. Okay, try to find out your own answer. Try to find out, what are they asking and why are they asking. All right. Whose mic is open? Okay. So important SPA and the practice books. All right. Please mute yourself, whoever are you. Hmm? All right. So practice books, there are almost 14 to 15, the practice books. and make sure that you do all these practice books, because all these standardized questions are given in all these books. You guys can take a snapshot of this. Okay, Andrew Sizer, Rekha Bhutankal, SPA part, Rekha Bhutankal, AMQs part, Justin Kune book, Brian McGowan book. This is Brian McGowan, Amanda Jones, Seema Sharma, Janish Gupta, Succeeding, Tahir Mahmood. Okay, then Tahir Mahmood, the ENQ part, Andrew Sizer, P. Sinha, Prabha Sinha, Rekha Bhutankal, Kalaivani, Andrea Pilkington, Succeeding, Justin Kone. Okay, stop here and listen to me very carefully. Almost all these books are old. Relatively, this book came in 2018. Okay, this book came in 2020, I think, COVID era. All right. Now there is second, the edition for this book as well, Tahir Mahmood. Okay. I think it came in 2000 or 23 or 24. After this book, even many guidelines have been revised. So some of the key answers can be, the wrong based on old guidelines. Okay. So make sure that you are not blindly following the keys. I personally, if somebody asks me that what are your, the top picks, from all these books, I would say my top picks are this, this for SBA, this for SPA, this, my most favorite book, Justin Kune. It has got standardized questions. Okay. Maybe the answers are not that correct because this book, although it released in 2020, but still it has got very old references. Okay, for me, this Get Through book is very good. For me, this EMQ book is very good. This book is very good, Rekha Bhutankal. Okay, it has got plenty of book, the questions which might look like that, they are extracted from your, the past recalls. All right. So yes, you can pick, all these books. Almost what I have counted so far is that you have got 14 to 15 books. So make sure that you buy all hard copies. Okay, that is a good idea to buy hard copies and solve your question with the help of pencil. So you can erase, you can, revise them. It's a good idea that after finishing one guideline, you thoroughly look for that guideline questions from all these available books. This is how I used to study. Okay, so it gave me a very good idea about all these books, that okay, which question is given in which module, which page, and which para. So it was very good idea. Although it looks cumbersome, but if you are doing, the study with your study partner, so this way, like 5 books can be searched by one candidate, the other 5 books can be searched by another candidate. So this is how you have to cover all these books. Otherwise, you won't be having an ample amount of time by the end of your own preparation as well to finish all these books, because there is no way that you can have extra time to do, this book, or this book. All right. So do practice all these questions from the beginning. So by the end of your preparation, you will be thorough that how to study, how to solve questions, how to come to the conclusion, how to find out a correct answer with the correct explanation. Then if you talk about the online sources, then yes, we do have, the very good sources. Strategy e-learning, a good source. Pass MRCOG, if you are eager to do more questions, Pass MRCOG is a good source. Okay, so it's a good idea that at least you do the 2 to 3 thorough question practice from strategy till exam and put more focus on the explanations as well, because many questions can come directly from explanations. All right, so these are online, of course, the paid, the sources. So don't rely on any hard copy material, any soft copy material which is circulating on social media here and there. Okay. So always remember, this is your exam and you have to struggle. You have to fight for yourself. Nobody is going to fight for you. All right. So don't rely on ready-made material. Study yourself. Every course is going to help you. Every mentor is going to help you, but they can't go at your place in your exam. All right. Clear so far? Any question? Mm-hmm. Oh, okay, okay. I'll be talking about that in a bit. Okay. So don't worry. So now I'll be talking about how to successfully fail an exam. Successfully fail, right? So successfully fail means that you are going to fail if you are having lack of confidence, if you are overconfident, if you are following too many advices, because I'm sure you all know and you must have heard that too many cooks spoil the broth, isn't it? So if too many advices are there, then yes, you are going to be, the kind of juggling later on that, what to follow, what not to follow, because every advice looks very tempting, isn't it? Following too many sources of one topic, following so many or almost every single group on social media. What is the end result? A demotivated, frustrated, and a lost exam candidate. Okay? Trying to find out ways, okay? Opening one group, closing the other group, going to the one mentor, going to the other mentor, following too many sources. So, what is happening in the end? A tired and a demotivated soul that I cannot do this because it is very difficult. No, it is not difficult. Trust me, it is not difficult. Okay? If you follow, the closely one or two groups, okay, or one or two mentors, all right, you don't rely on, the ready-made stuff. You just rely on you and yourself only. Things are going to be very easy. All right. Otherwise, you will be just wasting your time in one group, two group, three groups, and reading the messages here and there. Trust me, try to save your energies. When I say energies, it means that I'm telling you from the first hand knowledge, having an experience in being first of all being a candidate of so many exams, and then yes, a teacher for so many years as well. Okay, I know that how it feels. Okay, so don't bring yourself up to that level that when you will successfully fail an exam. Just be moderate, be confident in yourself. Always remind yourself that yes, I can do it, I am going to do it, and then yes, I have to do it. And by the end of your exams, once you will pass it, then yes, successfully you can say, I have done it. All right? And make sure that you look at that goal. So don't let this be you. Plan ahead. Plan ahead. All right? Then key for preparation. Like I said earlier, organize yourself, make folders. Okay? You can have make the folders on your desktop, laptop, iPad, MacBook, or even you can get them printed. Have a good grip on all salient points. Emphasize on facts, figures, and percentages. Discussion helps. Okay, when you seek one question or anything multiple times, whenever any confusion comes in one topic, open resources yourself and cross-check latest talks, guidelines, references. So remember again and again, let me be repetitive, that your guidelines are your prime reference. Make your own small book, okay? Notebook. So you will have your own material ready, own summaries ready to study from by the end of your preparation. Discuss. Try finishing your study in the first 3 to 4 months and then revise them all in 2 to 3 times till exam. Revision helps, discussion helps. Having said that, discussion means that you are studying thoroughly yourself first, then you are trying to discuss it with your study buddy. Or if you don't have any study buddy, if you're part of any group, so many groups are there which are successfully being run by the dedicated, the teachers around. So you can choose anyone and you can study. All right. And if you are part of our groups, so yes, we are also running a very dedicated study on daily basis, so you can study. Nobody is going to come at your, the doorstep and invite you. If you want to study, you are more than welcome. If you don't want to study, you can sit and you can just sit idle and then yes, you can just watch Cartoon Network, isn't it? Even though it is closed as well now. All right. So be positive towards what you learn and try to absorb it with examples, referencing, and reasoning. All right. So you just need to stay focused, calm, motivated. That's it. No key is going to be there. All right. So MRCOG part 2 is going to give you, the a clear perspective. All right. So we are going to start our course from, the today. All right. This is our first session. And this is going to be till exam. You are going to be with us. You are going to be you are going to be part of, my group. I'll be part of you as well in this whole journey, because for the 6 months we are going to be seeing each other. All right. So do not worry about your duty rosters. You just need to be hold to the schedule. You just need to join, the live sessions according to the schedules by setting your duty rosters. If not, then yes, recordings will be available with you. Okay. Now we have got a beautiful website. So anybody who is going to be part of our group that is going to be logged in into the website, every single thing is going to be available there. All right. So this is our, the schedule. All right. So from, today's introduction, so then we are going to be having a second session on antenatal care. So from today, from tomorrow, in fact, the a mini schedule will be given on the topics of antenatal care, and a dedicated mentor will, the discuss on a dedicated slot every day. Okay, and every candidate who is part of our course will be discussing with that, the mentor, and then in the online session, the same module will be, discussed with me. So this way, you are going to be having a very good and thorough discussion. Maternal medicine is a vast module. Okay, so I have divided this module into 6 sessions. So in 6 sessions, you will be covering maternal medicine with me, and I don't brag about myself, but I am proud of this thing that I teach, and I do try to teach maternal medicine very nicely. Because many students who know me, they know me that earlier from becoming the OBG, I was a medicine candidate. Okay, I did my FCPS Part 1 in maternal medicine. I did start my residency. I did it for 1 year, and then I switched to OBG. So I feel myself lucky that I have a very strong base of maternal medicine. So I do try to teach maternal medicine with reasons, with examples, and I do try to teach it nicely. Okay. So yes, maternal medicine, because it's a huge module, so we will be covering it in 6 sessions. All right. And by the end of the 23rd of December, everybody will be free. 22nd of December or 10th of December, everybody will be free. So almost 25 sessions are going to be there. So I think they are too much to cover, one, the curriculum. All right. So of course, we all are, the doctors working in hospitals as well. For me, I'm the specialist working in a very good hospital. So sometimes, there can be any change. So, or sometimes there can be any unforeseen circumstance. So any modification will be communicated in advance. So everybody will be clear on the same page, and to avoid any miscommunication, everybody will be, the aware of that on which date, on which day, on which time we are going to be having online session. All right. By the end of sessions, you will be having mocks as well. So yes, there are going to be, the very, very, the plenty of, what you can say, that plenty of rehearsal. So it all depends on how you, the bring yourself forward in carrying the all these, the schedule and all. Otherwise, me and my team would always be there to help and guide. Okay. So last 2-3 sessions are going to be revision, that we are going to look at multiple, the topics, and just to see that if we have missed anything. All right. Because once you are going to be thorough with your curriculum, then yes, you are going to be having your own, the idea about this curriculum, that, okay, what we have missed and what we should have been covered, or what has not been covered so far. All right. So we will revise. Okay. Clear, everyone? Any question? So utilize your neurons wisely. Okay. Having said that, utilize your time, utilize your energies, utilize your money, utilize your, the everything, in fact, wisely. Invest yourself wisely, I must say. Okay. Any question? Vidya, Najla, Anjana, iPhone, Far, Saima, any question? Mhm. So nobody is interested in asking question. It means everything was quite clear so far. Oh, yes, 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 Anjana. Okay, so please send me your number in private. So my team member will contact you shortly. All right. So everybody, in fact, is welcome to join our course. My fee is very nominal, and I do teach with, the dedication, and because teaching is my passion. I'm not after money. I'm not after, the so many, the candidates. I am just after my excellence. I'm just after, the quality teaching. So once you are going to be with me, you are going to be part of me. Okay. So of course, we are going to be together for about 6 months. All right. So I'm hoping that, GMC registration with RCOG. Yes, you can get RCOG registered, but after doing all three parts of MRCOG. Okay, that's it. No problem, Saima. This recording will be uploaded. Okay, so you can get back to me. Even you can talk to me in person as well. I will send you a link. No problem. All right. GMC registration. Yes, I was on that topic. So let me just tell it to you again. Once you are going to be MRCOG, complete MRCOG, then you are going to get registered with GMC. After MRCOG, you will do your OET or IELTS, okay, and then you are going to get registered with GMC. GMC is a framework to practice in the UK. After having GMC registration, then you will start looking for your jobs, and then that's going to be another journey. Okay. If you want to work into UK, so you've got three routes now. One is MRCOG, other is PLAB. PLAB is going to be the basic, the route. Okay. You will start from the junior level. After MRCOG or MRCPI, you can start from middle grade level. All right. So never think that if you are working as a consultant in your respective country, so you are going to be taken as a consultant or a specialist in UK directly. Okay. Remember, this MRCOG and MRCPI are membership exams, and they are mandatory for every student over there. Okay. So for us, it may be an additional qualification, but for them, it's a mandatory qualification to go ahead in their training programs. Okay, Najla, clear now? All right, brilliant. Okay. So anyone, if you have any question, I'm a very, the open person. I am available, freely available, in fact, the WhatsApp, Facebook, Telegram, okay, Insta. You guys can, the approach to me anywhere if you want to have any, the private talk, if you want to discuss about your any, the matter as well, if you want your, the advice, you guys can always be there. No. Complete MRCOG part 3, okay? Either MRCOG, three routes to enter into UK. MRCOG, after every route, you have to have GMC registration. MRCOG, number 1, MRCPI, and PLAB. Okay. This is a license examination at the junior level, that MRCPI and MRCOG. So after all, this, you have to do the, the IELTS or the OET, and then you will get your GMC registration. That's another thing. You can't work in UK just with part 1. All right. You have to finish either PLAB 1, PLAB 2. You have to finish complete MRCPI. You have to finish complete MRCOG. If you are MRCOG1, it's a good idea that you can write MRCPI. Okay. MRCPI is a relatively, the easy path, because it has, the theory, 100 question, one paper, and then it has got, the OSCE. That is bit easy so far as compared to MRCOG. But if you want to talk about the standard, then yes, for UK, they 90% they prefer MRCOG. All right. But otherwise, EBCOG, no. EBCOG is not yet, the recognized by any country as a specialization except Malta. If you want to move to the Malta, then yes, Malta is a very small European country. If you think that you can find out a job in Malta, then yes, on the basis of EBCOG. Otherwise, so far, up to my knowledge, maybe, here and there, but up to so far, my knowledge, it is not accepted as a standard qualification to work as an OBG. All right. But yes, it's an additional qualification. If you want to have additional qualification, if you want to go through, if you want to have an experience, then yes, you can go for it. For me, I have done this European board because that was a COVID era. Okay. And the theory exam was online. So, it was a very good idea for me to go for online theory. All right. So, everybody has different circumstances. And at that time, I was thinking that, I was an old grad because I did my MRCOG back in 2018-19. So at that time, I was thinking that, okay, I'm an old grad now. So, okay, let's do this European board. So I refreshed my knowledge. So everybody has different, the circumstances and perspective and, the preferences as well. But let me be very honest with you. Every exam has its own difficulty, its own, the fee structure, and being an overseas, our main hindrance is financial aspect. Okay, so choose wisely, and even after passing these exams, you will be part of that, the Royal College or the any board. So you have to give the annual fee as well, renewal fee. So it's not an easy task. Okay. So at every, the single level, you will be having a different, the kind of, not say difficulty, but maybe, the one step ahead. All right. So once you become a MRCOG, you have to renew your membership every year if you want to be part of, the Royal College. Okay. What is the situation for MRCOG? It's all depends on, the how good you as a student are. Okay, if you are a good student, you can pass this exam. Okay, it's a very good situation. It's not a bad thing at all. So it all depends on, the how you prepare, how you go for any exam. Every exam is difficult, but not impossible. Okay? Like I said, that every exam has its own difficulty, its own, the path, its own hurdles or hindrance maybe. But yes, every exam is doable. I have done almost 4 boards, so I came across with different type of, difficulty in every exam. So it was not a, the kind of constant thing anywhere. All right? Any other question?
Excuse me, sir. Can I have a question, please?
Yes, sure.
Yeah, I have heard that if you are not working like in the UK, they won't take us the MRCOG 3 exam. Is it right or it's not right? Because I'm not working in the UK
No.
and I'm now in the UK. I
Uh-huh.
don't work anywhere inside the UK in NHS. Can I have MRCOG 3 exam?
Yes, you can have, if you have mentioned your address, okay, the local address in the RCOG website,
Yeah.
UK. If not, then change it. If you are in UK, if you are going to be in UK, it's a good idea that you change it now. All right?
Oh,
Okay?
yes.
Because the seat would be according to your, the given address on the UK website. All right?
My address was from Afghanistan, but
Mm-hmm.
then I couldn't pay for my exam
Mm-hmm.
from here.
Mm-hmm.
Then I changed my address from
Mm-hmm.
Afghanistan to UK. Then I
Mm-hmm.
could pay
Yes,
from
yes.
my buyer.
Otherwise, you would be getting seat in the Kabul or Afghanistan, right? So make sure that you change your address now. All right.
Yeah.
If you think that you are be in UK for another couple of years, then it's a good idea that you change your address now. Okay.
Yes, thank you. And
Welcome, welcome.
I have heard that if you are not active in work, you are not in any public hospital, they won't take MRCOG 3 exam. Is it right?
No, it's wrong. Completely wrong. They don't know who is working and who is not working, right? Many candidates are writing exam being an overseas. If you were in, the Afghanistan, so do you think that anybody would come from UK and, they find out that you are working or no? No, it's not true at all. Okay?
Yeah,
So it's
yeah,
it's your responsibility that once you enter into, the UK, so I'm sure that, all of us, we all work this way or that way. Maybe not actively working, but yes, we do work. All right, maybe in a small hospital, maybe in a small clinic, maybe, the working, in a small, the RHC, regional health center or somewhere here and there. So it doesn't matter. Even if you are not practicing at the moment, but for MRCOG Part 3, you have to have your the training certificate attested, or the certified from or accepted from RCOG. Okay, so you have your
yes.
all certificates, Nachla?
Yes, I have the 4 years work as well,
Mhm.
medical college certificate, everything.
Very good. Okay. So keep your record straight, keep your, the everything straight. And inshallah, once you will pass your, this MRCOG part 2, immediately send your assessment of training. Okay, all these certificates. So once you will send your all these certificates, your training will be accepted, then yes, you are good to go for your part 3. Nobody is going to ask you that what you have done, where you have worked, and are you in working in UK or see, I have finished this exam being an overseas candidate. And today you
Yeah.
can see where I am. Okay? So it
Are
doesn't
you in the
matter.
UK?
No, I'm in Pakistan.
Oh,
Okay? So it doesn't matter. It doesn't matter. Okay? Many of us has passed this exam being an overseas candidate. Doesn't matter if you are in UK, doesn't matter if you are here and there. Okay? Yes, yes, yes. It will be counted, Saima. Okay? It will be counted, but you have to have your experience. Yes, it is. If your experience letter shows that you are working in labor ward, you are working in theater, you are working in post-op, you are working in postnatal ward, so it's okay. All right. So everything should be legible, everything should be on hospital letterhead countersigned by your HOD. All right, then it would be, the good. If you don't want any renewal, then you won't be part of RCOG anymore. You will be having a RCOG certificate, but you won't be part of any RCOG. Okay? Being part of RCOG gives you, the edge that you can relocate anytime if you wish to. All right? And you can work in UK. Similarly, GMC registration as well.
excuse me, sir. And
Mhm.
if we do MRCOG 1, we passed, then we do MRCP, then we can do MRCOG part 3.
Yeah, no, 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 no. MRCOG part 2, theory, and then OSCE. If you pass it, then yalla, you are good to go for this GMC registration. Okay? You can get GMC registration on the basis of MRCPI. Okay? Remember, both exams are different. This is for Ireland, this is for UK. So you can't, the switch between these two. All right? So if MRCOG, MRCOG 1, 2, and 3. If MRCPI, Ireland, it has to be after MRCOG part 1, you have to give theory, or that is part 2, and then OSCE. That's it.
Yes, thank
Okay?
you.
Welcome, welcome, welcome. All right, guys. So thank you so much for being here. Thank you so much for being attentive. And inshallah, I will see you around, or maybe I'll be conducting another session, maybe after like 1 or 2 weeks. So we will discuss about recent guideline. Okay. So thank you so much. Looking forward to have you, the being with me for another good 5 to 6 year, the months maybe for January exam. All right. So inshallah, I will see you around. Okay. Take good care of yourself and your loved ones. Bye bye. Allah Hafiz.